Hi, excited to be with you again from Unified OSCE. In this video, I'll take you to the implementation station, but with focus on ectopic scenario. Are you ready? Let's get started.
Read the candidate brief, noting the time due for medicine to be administered, safety check for scene safety, address any safety concerns, if any, provide privacy, treat your patient with respect and dignity, carry out hand hygiene before and after patient contact in line with WHO standard following infection control policy, introduce self, state purpose and gain consent. Check patient identity using the 3 identifiers, demonstrating the actions. This will be done twice. Confirm allergy status and the reaction. Check for pain. Rate the pain using the Universal Pain Scale tool. Reassure her. Do a quick intervention if pain is stated.
As I approach the scene, I can confirm the scene is safe to approach, not to cause harm to myself or my patient. I pull the curtain to provide privacy and dignity. I go ahead to do my hand hygiene in line with WHO standard. Put an ampoule of gel. Allow my hands to air dry for 30 seconds as I approach my patient. Hi.
Hi, nurse.
Yeah, my name is Ademola. I'm your attending nurse for today. I'm here to give your due medication due at 14th hour. Is it a good time to do that?
Yes, nurse.
Perfect. But before I go ahead, I would like to confirm your full name with date of birth as I confirm with the documents I have with me and your wristband. Can you tell me your full name, please?
Janet James,
Date of birth?
1/1/1992.
Perfect. I can see I've got Janet James 1/1/1992 on my documents and your wristband, and the hospital number is 54321. What would you like to be called?
Just Janet.
Okay, wonderful. Janet, have you got any allergy to food, drug, or latex?
No, not that I know of.
Perfect. There's no any red wristband, and I've got no documentation of allergy on my documents, and that's wonderful. Are you in pain or any form of discomfort?
Just a little, I've been a bit of pain around the vertebrae.
Oh, sorry about that. I would like to rate your pain, where 0 means no pain and 10 means the worst or severe pain you've ever had. Can you rate your pain for me, please?
It's a 4.
Oh, sorry about that. Can you just take a deep breath in and breathe out? Is that helpful?
Yes, nurse, I'll manage.
Okay, wonderful. I'm here to give you medication, like I said. If you are due for any analgesic, any painkiller, I'll be right back to give that. And if not, I'm going to escalate this to the surgical team. Is that okay with you?
Yes.
Are you happy for me to proceed?
Yes, nurse.
Wonderful. And before I give the medication, I would just like to take you through the chart.
Read the MAR charts out. Ascertain rights of medication are valid and complete, in line with competence, effective practice and professionalism. State the action, and likely side effect. Refer to BNF if uncertain. Confirm parameters are appropriate if required, e.g., blood pressure when giving antihypertensive.
Yeah, for the first page, I'm going to read all the details, but subsequent pages, I'll go with the full name and plus either the date of birth and hospital number, either of the two with the full name will be fine. So I've got with me Janet James, date of birth 1/1/1992, hospital number 54321, height 1.6, weight 70 kilogram, body surface area not stated. Waters Women's Health, date of admission is today. Consultant is Dr. A. Kittredge, time of admission 10th hour. Signed by Dr. A. Kittredge 36544, GMC number, signature A. Kittredge, and blip number 155. Details of person I'll be administering medication. I'll be coming back to sign this. Under the alert, there is no any medication for allergy. And the no is tick and duly signed by Dr. A. Kittredge, blip number 155, and date is today. Medication risk factor, there is no any tick risk factor. And if any is tick, just mention it and you'll be mindful of that. Moving to the next page, I've got Janet James, date of birth 1/1/1992. All of that details are correct. The code is stated. We're coming back if that is required. Under once and only medication, date is today. Drug is paracetamol, dose is 1 gram. Route is IV. Instruction is for pain. Time required is 10:30 hour. Duly signed by Dr. A. Kittredge, blip number 155, and time given was 11th hour. Signed by a colleague, A. Bash, and pharmacy check, KH. Moving to the next page, I've got James Janet, 1992. All other details are correct. There, Janet is not a CO2 retainer. The box no is ticked, and there's no set target for oxygen. If there's any set target stated, I'll just confirm from the assessor if Janet is maintaining the set target. I move to the next page, which is Janet James, 1992, under antimicrobial. Clarithromycin date is today, dose 500 milligram. Frequency is 2 times daily. Route is per oral. Duration is 7 days. Start date is today. Finish date is plus 7 days. Culture sent yes. Indication is antibiotics and prescriber signature. Duly signed by Dr. A. Kittredge, blip number 155. Print name Kittredge. It's due at my time, which is 14th hour. Janet, clarithromycin is one of the medication they use to treat bacterial infection. And some of the side effects could be some mild diarrhea, nausea, and vomiting, which you may experience and you may not experience. Are you happy to have this medication?
Yes, I am.
Okay, perfect. I'll be coming back to give you this. And there's no any medication, other medication on the antimicrobial. I'll move to the next page. I've got James Janet, 1992. All other details are correct. Under regular medication, I've got paracetamol. Date is today, dose 1000 milligram. Frequency is QDS, 4 times daily. Route is per oral. Duration is 47 days. Start date is today. Finish date is plus 7 days. Instruction is for pain. Duly signed by Dr. A. Kittredge, blip number 155. Paracetamol is for pain, and some of the side effects could be nausea and vomiting, which you may experience and you may not experience. This prescription is valid, legible, and complete. However, you had paracetamol under start dose. I will go back to the start page. You have it at 11th hour, and this is 14th hour. That is 3 hours gap. So I will not be giving you this at this time. I'm going to give it a code of 5. I'll put my signature and I'll circle the 5, which means start dose was given. The next medication I've got ferrous fumarate. Date is today. Dose is 210 milligram. Frequency is once daily. Route is per oral. Duration is continuous. Start date is today. Finish date is continuous. Instruction is for anemia treatment. Duly signed by Dr. A. Kittredge. Blip number 155. Print name A. Kittredge. This prescription is valid, legible, and complete. Okay, Janet. Ferrous fumarate. It's a supplement to treat anemia. Some of the side effects can be constipation, and your poo may become more darker, which you may experience and you may not experience. Are you happy to have this medication?
Yes.
Okay, perfect. I'll be coming back to give that. I've got another medication under regular, which is folic acid. Date is today. Dose is 5 milligram. Frequency is OD. Route is per oral. Duration is continuous. Start date is today. Finish date is continuous. Instruction is supplement. Signed by Dr. A. Kittredge. Blip number 155. Print name L. Kittredge. Is due at 14th hours. This prescription is valid, legible, and complete. Yeah, folic acid is one of the tablets used vitamin supplements, and some of the side effects could be nausea, vomiting, some bloatness, which you may experience and you may not experience. Are you happy to have this medication?
Yes, I am.
Okay, perfect. I'm moving to the next page. I've got Janet James, 1992. All other details are correct. Under as required, I've got paracetamol. Date is today, dose is 1000 milligram. Frequency is 6 hourly. Route is per oral. Duration is continuous. Start date is today. Finish date continuous. Signed by Dr. A. Kittredge. Blip number 155. Print name R. Kittredge. And this is as required medication. But I will not be able to give this, though you said you're in pain. I will not be able to give it because it's just 3 hours when you had paracetamol last. But I'm going to escalate it to the doctor to have something else prescribed for you for the pain. Is that okay with you?
Yes, ma'am.
Okay, thank you, Janet. So I'm not going to code this because it is as required, but I'm not going to give it at the same time. And there's no any other medication on that's required. The last page, I've got infusion. Janet will have infusion today, 0.9% normal saline. Volume was 1000 ml. Route IV. Duration or rate is 250 ml per hour. Prescriber signature A. Kittredge. and pharmacy check AB, and it was given by colleague K Tang, checked by Skook, and it started at 11:10, finished at 13:10 hour. 1000 ml was given. Looking at your intravenous site, I can see there's no any form of redness, and it doesn't look swollen. And have you got any pain on the cannula side? No. Okay, wonderful. So I'm happy the site is fine. So, and that will be all. So I will just, on the last page of drug omitted, I'm just going to put the code. Date is today. The drug is paracetamol. Dose is 1000 milligram. Route is per oral. Instruction for pain. Time given, not given. The start dose, the reason had start dose already. And I'll put my signature, and I'll be going to serve the medication.
Confirm the medication trolley is locked and open for medicine administration to preserve safety. For each medication you have to give, validate the dose, name, expiry date, batch number, and dispense of each tablet in separate pots demonstrating effective practice. Do your second identity allergy check. Ensure the patient is sitting in an upright position, and check for swallowing problems. Administer medication safely, confirm it is swallowed, and verbalize you will be back in 30 minutes to check for effectiveness or any side effects. Take permission to document accurately and put the right code for medicine not given if applicable.
Hi, Janet. Here's the call bell. I'll be right back just to dish your medication. Is that okay? I'm just a step aside from you. If you need anything, just press the bell. Okay, assessor, I've confirmed from the assessor that um the medication trolley is under lock and key and open just for the purpose of medication administration. Okay, I've opened my trolley. The first medication I'm due to give is clarithromycin. As clarithromycin, I've confirmed is the right medication. Tablets clarithromycin 500 milligram. Each tablet is 500 milligram, so I will need just one tablet. Expiry date is 23/08/28 and batch number is 1433. I'll be taking one tablet. I'll put it on the cap of the medication and I'll transfer it into the medicine pot. Secure this and put it back. And the next medication, paracetamol, I'm not given. I've coded that. I'm given ferrous fumarate, 210 milligram once daily, which is still at my time. So I've compared it. It is ferrous fumarate. Each tablet is 210 milligram. Expiry date is 28/8/28. Batch number 3456. I'll open it, take one tablet, put it on the cap without touching the tablets. I'll transfer it into the medicine pot, secure it, and return it back. And the next one I need to give is folic acid. I've got folic acid, 5 milligram. Each tablet is 5 milligram. I'm given 5 milligram. Expiry date is 22/07/28. Batch number is 1324. I'll take one, put it on the cap, put one tablet on the cap, careful not to touch, and transfer it into the medicine pot. Secure it and put it back in the trolley. And make sure my medication trolley is locked under lock and key. Do a quick hand hygiene. And I'll be going back to Janet. Hi, Janet. I'm back with your medication. Yeah, can you just remind me your full name and date of birth, please?
It's Janet James, 1/1/1992.
Perfect. Janet James, 1/1/1992. And you've got no allergy. Is that right?
That is right.
Okay, perfect. You're sitting upright already. Do you want water first or your medication first?
I'll have my medication.
Okay, do you want it separate or you want all at once?
All at once if possible.
Okay, that's great. And you're sitting upright already. Have you got any swallowing difficulty?
No, no.
Do you want your medication all at once or one at a time?
One at a time.
Okay, wonderful. I've got water for you. So I've told you the action and side effect already. Okay, I've got your ferrous fumarate. Can you have it, please? Wonderful. And here is water. Is it gone?
Yes, it's gone.
Perfect. And this is your folic acid. Can you have it, please? And here is water. Is it gone?
Gone, nurse.
And this is your clarithromycin. Can you have it and have water? Is it gone?
Yes, nurse.
Perfect. Are you comfortable?
Yes, nurse.
Here's the call bell. I'm just a step aside. I'll quickly document what I've given. So the first page, I'm writing my full name, my initials, signature. The base is women's health, which is the word. Going through all the pages so you don't miss out anything. Clarithromycin, I've given that. I'll sign my name and I'll write the dates. Under regular, I've coded the paracetamol because start dose was given. For ferrous fumarates, I've given that. I put my signature and date. Folic acid, I signed and put the dates on that today. And the last page, I've written the medication coded because the start dose was given. And I'll be going back to Janet. Hi, Janet. I'm back. Like I said, are you okay?
Yes.
Okay, just checking on you. I said I'll be checking on you after 30 minutes to check the effectiveness of the medication. And that will be it. I'll be leaving you for now. Do you have any question, any concern for me before I leave you finally?
Just how long will I be expected to stay?
Oh, the surgical team will be coming to see you. They will have a check. Once they're happy with everything, they will let you know when exactly you will be going home. Is that okay?
Yeah, that's fine.
Okay, thank you so much for your cooperation. Here is the call bell. If you need any help, just press the bell and I'll be right back. And that's it. All the best.